Good evening. Good evening, everyone. Good evening, everyone. Good evening. Cellulitis is it is an infection of a dermis and hypertrophy is and its caused organism is group A Streptococcus and Staphylococcus aureus. The rule of 9 refers to burn percentage in adults and children or severity of burn. The burn assessment is done by the rule of 9, a condition that causes thin concave nails raised at edges looking like a spoon is called chylomicrosis, which grafting of burn wound are covered with the patient's own skin autograft. craft exchange between the members of genetically unrelated animals. Inflammation of tissue surrounding the nails is known as pharyngeal. When black and blue marks appears on skin due to the trauma, it's called bruises. Which one is the real Parkland formula? To estimate the blood requirement in the first 24 hours in serious burn patient, 4 ml into total burnt surface area in percentage into body weight in kgs. Most common cause of death after burn in 24 hours is respiratory compromise and hypovolemic shock. Most common cause of death in a client with burn after 24 hours is infection and septic shock. Infection of soft tissues around the under the skin is cellulitis. Which degree of burn is less painful? Third degree. Third stage. Third degree burn are painful with deep pressure but less painful but more serious type of burn. Second degree burn are more painful with the movement or changes in temperature and blister formation. Bluish discoloration of skin is known as cyanosis. Blisters are mainly seen in second degree burn. A sudden redness of the skin is known as flush. Lymphatics are found in dermis of skin graft that is taken from another part of the patient's own body is known as graft. Causative organisms of herpes simplex is HSV. The most common type of burn injury is thermal. Removal of excess abdominal skin and fat is known as hysterectomy. Cardinal sign of hypocalcemia is joystick sign. Drowsy sign, the hand. Joystick sign, the twitch of the facial muscles following gentle tapping over the facial nerve in front of the ear that indicate hyper-irritability of the facial nerves. Drowsy sign, the hand adopt a characteristic posture when the sphygmomanometer cuff is inflated above the systolic pressure within 3 minutes. Excessive production of the thyroid hormone is known as hyperthyroidism. Juvenile diabetes is type 2 diabetic. Hyperfunctioning of anterior pituitary and pre-pubertal children cause gigantism. Drowsy sign seen in hypocalcemia. Positive joystick sign of hypocalcemia. Positive joystick sign is a sign of hypocalcemia. Addison's disease is caused by a deficiency of ACTH, adrenocorticotropic hormones. Low ACTH and high cortisol level may lead to Cushing syndrome. High ACTH and low cortisol level may lead to Addison disease. Mean the disease caused by the deficiency of the hormone insulin is DM, diabetes. Graves' disease is hyperthyroidism. Ketone bodies are found in urine of patients with uncontrolled diabetes due to increased metabolism of fat. tumors with Sanyogita and small adenomas of the pituitary gland can be removed through supratentorial approach. The cause of type 1 diabetic acidosis ketone diabetes is related to blood sugar. What is called acropathy in hyperthyroidism is digital clubbing and swelling of fingers. In a patient, the tiny like spasms, which are caused due to imbalance which electrolyte hypocalcemia. Addison disease is also known as a chronic adrenocortical insufficiency. The reduction of insulin leads to diabetes. Hypersecretion of growth hormone after the closure of epiphyseal plates can cause gigantism. The most common complication of diabetes mellitus is hyperglycemia, which of the best measure to determine long-term control of blood sugar in a patient with diabetes. Mellitus is HbA1c. The nurse is caring for a patient who's hypoglycemic. This patient will have blood sugar glucose level below the 70 mg per dl. Deficiency of thyroxine in adult lead to a condition called myxedema. In a diabetic woman, the presence of ketone bodies in urine and postural breathing is suggestive of diabetic ketoacidosis. After total thyroidectomy, patient should be kept in which position? It's semi-collar position. SGLT2 inhibitors are a class of medications used to treat type 2 diabetes. SGLT inhibitors are also called sodium transglutaminase. This is the renal glycosuria is seen when blood sugar level is more than 180%. Who discovered the double helix structure of deoxyribonucleic acid based on and Crick, which is the structure that plays the biggest role in cellular function nucleus. Decrease in the size of tissue or organ caused by decrease in the number of cells is known as atrophy. Tissues from lactic acid from glucose. This phenomenon is termed as anaerobic glycolysis. These are the basic unit or building blocks of living organism cells. The first phase of cell division is prophase, the process by which molecule of a solvent tend to pass from less concentrated solution into more concentrated one through the semi-permeable membrane is called osmosis. The type of cell division occurs reproductive cell is meiosis. The most abundant tissue in the human body is connective tissue. A process by which liquid droplets are ingested by living cell is known as phagocytosis, which cell organelle is responsible for making proteins, ribosomes. Uncontrolled proliferation of cell is known as hyperplasia. The pathway through which a cell produces the maximum number of ATPase molecule is glycolysis. The cell organelle are responsible for the formation of acrosome in a sperm in Golgi bodies, an energy consumption process by which cell of the human body absorb molecules such as proteins by engulfing them is called endocytosis. Endoplasmic reticulum is concerned with the synthesis of protein. The normal chromosome complement in male 46XY or 44 plus XY. Which is called the powerhouse of the cell mitochondria. The epithelial tissue which lines the urinary bladder is transitional, which condition is also known as a trisomy 21 Down syndrome. The total genetic material of an organism is known as genome. The structure that stores genetic information is the DNA. The pigment which is responsible for color of skin is melanin. From outer side to inner side, which order of layers of epidermis is true? Corneum, lucidium, granules, and germinative. Normal fasting blood sugar level is between 70 to 110 mg per diem. The most rapid absorption of insulin occurs in abdomen. Which of the amino acid used for the synthesis of thyroid hormone? Phenylalanine. Which hormone maintains serum calcium level? Parathyroid hormone. Which hormone decreases serum calcium level is calcitonin. Function of the PTH hormone. To maintain blood calcium level, PTH increases absorption of calcium from the intestine. The most important hormone secreted by the pineal gland is melatonin, which is mainly responsible for fight or flight reaction is adrenal medulla. Insulin is produced by which type of cell in the pancreas? Islet cell. Mechanism of actions of insulin occur through activation or in intracellular enzymes. त्रसते Good evening.